Hello, this is Lynn Albizo. Thank you for joining IDF's Virtual Advocacy Day 2020. We're really excited to have so many people join us remotely to learn about our policy issues and to reach out to your senators and representatives. I want to thank our lobbyists from Faegre Drinker for participating in this presentation, and I especially want to thank Jamie Sexton for leading this unique Advocacy Day effort. This is our mission statement, and I just want to highlight, as you can see, that this is included in our mission statement is advocacy, fostering a community empowered by advocacy, education, and research. So you're doing an important function. This is information about PI, which most of you know, and more statistics, and what we do. And I'm going to talk about what our legislative requests will be today. This is what you're going to be sharing with your representatives in meetings or in action alerts as we advocate for the PI community. We at IDF have come up with 4 priority areas, and this is access to quality care, screening and diagnosis, protections for the immunocompromised, and research and emerging therapies. We have 2 Advocacy Day asks today. The first is to extend the Medicare IVIG demonstration project, making it into a permanent benefit. And the second is supporting legislation that entitled Preserving the Patient Access to Home Infusions Act. This extends and reinforces access to SCIG therapy. The Medicare IVIG demonstration project is also known as the demo. This, what it does is, what we're going to be asking for is to extend the this benefit into a permanent benefit. We have several asks that we'll be doing related to this. Basically, what we want to do is turn this temporary benefit into a permanent benefit. We also want to take away the cap, which limited enrollment to 4,000 people, and ultimately turn it from being a temporary benefit into a permanent benefit. Some background. In 2012, Congress passed the Medicare IVIG Access Act. This established the Medicare demonstration that allowed enrollees with PI to receive intravenous immunoglobulin therapy, also known as IVIG, in the home. And then in 2017, the demo was extended through December 31st, 2020, coming up this year. The demo, which adds thousands of individuals with PI, aids thousands of individuals with PI by covering life-saving IVIG treatments, will end on December 31st if no action is taken. In terms of how this impacts the PI community, basically what the demo will do by extending it is to ensure that people with PI will not experience any lapse in coverage for their in-home infusions under Part B. It will allow people to be able to continue to be reimbursed for their medications, supplies, and services for their at-home treatments. And it will basically allow people to have IVIG in the safety of their own homes. And we know during this period of time, particularly, how important it is to have access to home therapies. Okay, the Medicare IVIG demo legislative ask. What we want you to do is urge Congress to take appropriate steps to extend the demo and to make in-home IVIG treatments a permanent benefit under Medicare. And you're going to want to share your concerns about the challenges of being able to receive IVIG at home, the possible lapses in coverage in IVIG, and the cost of at-home treatments if coverage is not continued. What I want to emphasize is that we do not currently have a bill So we're hoping that a bill will be dropped in the next couple of months before the end of the year. But we want to give a heads up to legislators, and then we at IDF will be following up when a legislation is introduced. Now we're going to talk about the Preserving Patient Access at Home Infusions Act. And this is Senate Bill 3457 and House Bill 6218. And what this does is ensures permanent benefit for at-home SCIG treatments and providing adequate access for beneficiaries with PI. And this covers, just so you know, more than just SCIG treatments, but SCIG is included as part of the benefit for durable medical equipment that is infused with a pump. And we've been advocating for this since the 21st Century Cures Act. And what the bill does is it clarifies the intentions of the 21st Century Cures Act. It ensures appropriate payment for education and training on SCIG infusions in the home. And it allows benefits to cover various services and supplies needed at home for SCIG infusions. A little bit of background. In December 2016, Congress passed the 21st Century Cures Act, and it included a service fee to pay for items and services needed for in-home SCIG therapy. At the last minute, a provision was inserted that delayed the service fee for 4 years. And as a result, we advocated for a temporary payment that was established, and that's what's currently being used. But in January 2021, that's when Medicare is scheduled to implement the permanent benefit. And this will support access to nursing, training, and other services needed to deliver SCIG using a pump. However, as part of the permanent benefit, there are some updates that are needed to ensure that all therapies are now covered and will continue to be covered after January 1st. Key provisions of the Act, they ensure that certain treatments that require patient training, education, ongoing support by a nurse are eligible for service payments, even if they're considered self-administered. There's a few very common drugs. There's one in particular that is designated as a self-administered drug, which under the original Act was excluded, and we need to fix that to make sure all medications are covered under this Act. It also includes important pharmacy services, and it permits payments for services on any date that a beneficiary receives a drug, regardless of whether a nurse or other provider is present. In terms of impact on the community, very importantly, it enables delivery of infused medication to patients in their home. As we know, during this difficult time, during the COVID-19 crisis, it becomes even more evident why it's so important for people that are vulnerable to pathogens to be able to avoid facilities and to receive treatment at home. And this goes beyond just what we're dealing with right now. We know as our community that being exposed to all kinds of viruses and pathogens are really dangerous. And finally, it also creates savings for patients by allowing coverage under Part B, and it's just a more effective and efficient way of delivering services in terms of compared to facility administration. So HR 6218 is the House version of the bill, and that, as you can see, the sponsors here, This is bipartisan legislation, so we will be advocating for your representatives, both Democrats and Republicans. And this is the Senate Bill 3457. And again, we're trying to get more Senate sponsors, both Democrats and Republicans, and we're hoping that your advocacy will help expand this list of co-sponsors. In terms of this legislative ask, as I noted, this is a bipartisan ask. We want to make sure that House Representatives co-sponsor 6218 and Senators co-sponsor Senate Bill 3457. Make sure that you share your fact sheets. That has everything that the legislators need, that can go into the details if they have questions. Don't worry if you are not able to recall all the details, because the fact sheets will include them. Also, they will have our information, and let them know that they can ask questions of IDF, send emails, and we're happy to go back and talk to legislators, whether it's making meetings virtually, of course, or sending emails to clarify any facts that people have. Points to include. So these are basically your specific asks, and please consider supporting the establishment of a permanent benefit for IVIG treatment under Part B, or at a minimum, extending the demo. And the second would be to ask for co-sponsorships of the Preserving Patient Access to Home Infusion Act. Remember, as I noted, if you have any questions, follow up with IDF. And also, it's always good to share that if they have constituents that are affected by PI, to use IDF as a resource. Thank you.
Hi, my name is Jamie Sexton. I'm the Government Relations Manager here at the Immunodeficiency Foundation. Thank you so much for joining us for IDF Virtual Advocacy Day 2020. We understand this is a whole new platform this year, and we appreciate you sticking with us through it. So today I'm going to present to you effective advocacy. These are skills that will be useful during Advocacy Day 2020, but also throughout the rest of the year through other advocacy opportunities that we'll discuss later. So the question I get asked the most is, how can I get involved with Advocacy Day? And the short answer is there are tons of ways. Here are our most popular. Our most popular, of course, is IDF Advocacy Day, which if you are listening to this, you are obviously taking part in. So thank you for that. Our Advocacy Day is annual. We do this every single year. And it is, of course, about federal issues. It's about advocating to Congress for federal issues that impact the PI community. However, our advocacy extends beyond just federal issues, and it extends to state legislatures. And that is where health access advocates come into play. Our health access advocates are a volunteer role at the state level where members of the PI community take action in their state legislatures and also in their local communities. Sometimes they can reach out to their city council as well. If you are interested in doing that, we will send out communications after Advocacy Day to all of our participants about how you can apply for that role if it's something that seems interesting to you. Also happy to answer questions at any point after this event about how to get involved and exactly what that participation looks like. Also on the state level are our state advocacy workshops. We conduct these each year in individual states, and it's a very in-depth training where we train you on issues that are impacting the PI community in your state at that particular time. Issues that could impact your community in the future, and issues that we're working on across the country at the state level. We train you very in depth on how to communicate with your legislators at the state level. And then also those workshops sometimes entail a mini Hill Day of sorts in your state legislature where you're putting those newfound skills to use, meeting with state level representatives then and there. The next level of engagement are IDF action alerts. Many people who are watching this training are going to be participating in Advocacy Day through that platform itself. Our action alert system provides you with a very easy way to contact your elected representatives. We very simply give you a call to action where we explain the issue we need you to take action on, why it's important to the PI community, and provide you with very simple tools to reach out to your elected representatives about it. We always provide you with a pre-written email to reach out to your elected representatives about the issue that we've alerted you to. We sometimes also provide you with a phone script. Those of you that are utilizing this platform for Advocacy Day today will see said phone script about both of the issues you're going to be advocating for, to provide you the option to call in to your legislator's office if that is the method you prefer. Lastly, we also have our advocacy playlist. This is our YouTube playlist that has videos about several different of our advocacy priorities. I highly recommend you taking a look at those. They definitely succinctly explain a lot of the issues that we advocate for at IDF in very basic terms. We understand that policy can be complicated, and that is a really, really wonderful resource to use to break those down very simply. So, through all those methods of getting engaged in advocacy, what are some ways that you can use those platforms to advocate? There are many different ways you can advocate for people with primary immunodeficiency. You can share your stories and experiences with policymakers. Those of you that are participating today understand how important that is, and that's why you're taking that step to participate today, and you're going to be sharing your stories and experiences. Next, you can testify at hearings. That is obviously not an option through today's platform. However, that is something that our advocates across the country have done numerous times, and it's a really wonderful way to get involved, and it's a very in-depth way to talk to a committee and explain why a particular piece of legislation is important to you and others like you. Work with other patient organizations on health access issues. This is another option that many of our advocates have taken. There are a lot of issues that impact not just individuals with primary immunodeficiencies, they impact individuals with a vast number of rare diseases. And so a lot of our advocates pair up with other rare disease patient organizations to work on mutual policy priorities. You can also mobilize other members of the PI community. Our voices unified are much louder than an individual voice alone, and so individuals that choose to mobilize are really able to make a big impact. Respond to action alerts, we talked about those previously. That is definitely a very good and relatively easy way to reach out to elected representatives about issues. Again, IDF provides you all the tools to do that. You can simply personalize it and click send, or pick up the phone and make a quick call using the script that we provide to be able to use those. And then email, write, and phone officials to urge leaders to take action on issues affecting the PI community. We have a lot of members of our community that do this independently. There are many times that I learn about a bill in a particular state because an advocate copies me on an email that they're sending to their elected representative about the issue. That's wonderful, wonderful. I do recommend reaching out to IDF if you come across a bill, particularly in your state, that you feel like could be relevant to the PI community. Let's talk it through. Let's figure out exactly how it impacts the PI community, and let's make sure that we're taking the appropriate stance on it. So through all these methods that we've discussed of how to get involved, what's very clear is that your voice matters. You have tools that lobbyists and advocates for IDF don't. You have the real personal stories. Lynn and I can walk into a legislator's office all day long and explain why an issue is important to the PI community, but putting your face to an issue resonates with legislators in a way that Lynn, I, or Faye Drinker can't. And you're so important to advocacy, and it's so wonderful that you're taking this step to take an active role in advocacy for the PI community. As you know, people with PI and their families are the most effective at demonstrating how policies impact them. Just simply telling a legislator how it impacts the community is one thing, but actually being able to put your face to that problem makes a world of difference in a legislator's office. Just reaching out to them like you are today lets them know that this is important to you and this matters, and you can't be ignored. They have to address you. They may not be able to give you a solid answer of what they're going to support and what they're not. However, you can't be ignored when you're sitting on the phone with them. So we're going to hit on some talking points that you can utilize, not just during Advocacy Day, but anytime you're trying to speak with an elected representative about PI. You want to kind of give them the high points of exactly what it means to have a primary immunodeficiency. Try to do it in as layman terms as possible. You and I both know that there's so much more to it than you have a missing or improperly functioning immune system. But unless they ask for further, deeper details, let's keep it to the high points to make sure we're not losing them. You also want to talk about how your PI is treated. Talk about, SCIG, IVIG, but however, use the terms intravenous immunoglobulin, subcutaneous immunoglobulin. If you want to shorten it after that, say subcutaneous immunoglobulin or SCIG. Try to avoid jargon. We often lose people with jargon because they don't know what it means, and then as the conversation continues, they forget to ask. You also want to explain the issues with immunoglobulin, which is that it's costly and inaccessible to those without adequate health coverage. People with PI often have comorbid conditions, which also require expensive treatments. And then you also want to talk about full access to affordable treatments using the method of administration and site of care most appropriate for each individual is a priority for IDF. So tie all this together and explain why you're an advocate for IDF and how this all comes together. So how do we tie all this into today, Advocacy Day? We say here, you can't walk the halls, but you can make the calls. Unfortunately, our Advocacy Day today is a little different than it has been in the past. Obviously, with the COVID-19 pandemic, we can't be in DC today. We understand that can be really disappointing for some, but we can still be just as effective, if not more so, on the calls today. So, some logistics for today. As I mentioned previously, many of you who are watching this training will be participating in Advocacy Day through our action alert system. You'll be provided with a pre-written email, you'll be provided with a phone script. So some of these logistics may not apply to you. However, I still recommend watching through because there are some tips about your Advocacy Day that are still very applicable if you're deciding to utilize that phone script. So for those of you that have pre-scheduled conference calls today, if you've participated in Advocacy Day previously, you know that we make groups. These groups will include attendees from the same state. We will still have groups today on your conference calls. Unfortunately, they will not be personal conference calls of just you and a legislator. There will be groups, just as if it were an in-person meeting. Groups will not include an IDF staff person. So we'll kind of talk a little bit further about, how to arrange those logistically, but I want to emphasize the fact that you will not have an IDF staff person on the line with you. They will only be volunteer advocates. On that call, we're going to have you call in 5 to 10 minutes early. And while you're coordinating logistics, when you're calling in early, you're going to identify the constituent or constituents in your group. There should always be a constituent in your group on that call of that particular office that you are going to be meeting with. You're going to identify any special relationships. Maybe you go to church with the congressman's mom. You want to identify that relationship. And then you're also going to want to designate a meeting leader before each call. Don't look too much into the term leader. They're essentially acting as the facilitator for the call. As you know, you don't want everyone speaking at once. That can just confuse everyone, including the person you're meeting with. So the leader is going to do introductions. They're going to introduce people on the call. They're going to ask the person you're meeting with to introduce themselves. They're also going to introduce each person before it's their designated time to share their story to ensure, like I said, that everyone isn't speaking at the same time. Having a leader or a facilitator on each call will just help things go much smoother and much less confusing for everyone involved. So during the day, if you have downtime, as you know, since we're going virtual, I'm sure a lot of you are doing your conference calls from your couch, which is great. If you have downtime between your calls, we do have a few resources we would love for you to check out with that extra time. First and foremost, we definitely encourage you to try out the IDF Advocacy Day 2020 social media toolkit. We've provided you with handles of a wide array of elected representatives, including those you will have potentially been meeting with. Earlier, Lynn showed you the co-sponsors of the Preserving Patient Access Act. Tag them, thank them for co-sponsoring this vital piece of legislation for the PI community. Their handles are in that toolkit. Tag your elected representatives. Anything you can do to increase engagement with people on the Hill, since we can't be there in person, will be a great resource for the day. So definitely try to check that out first and foremost if you have any downtime. Second, you can learn about IDF public policy priorities. I mentioned earlier that we have an advocacy playlist. That YouTube channel can be very, very useful to understand not just our issues today, but also other issues that we've worked on at both the state and the federal level. I mentioned earlier some ways that you can get involved in IDF advocacy. That playlist is a great resource to understand some issues you could work on through those various means of engagement. Lastly, you can read how IDF is responding to the COVID-19 pandemic. The link is there. Please take a little bit of time to read that. You may be subscribed to our text alerts. You may be getting emails about the things we're doing, but that is a great comprehensive resource with all that information in one place. Let's talk a little bit about how the days will go. As I mentioned earlier, you're going to want to call into your calls 5 to 10 minutes early. I, of course, like to err on the 10-minute side. However, if you're a latecomer, if 5 minutes feels like all you need, so be it. But please call in 5 to 10 minutes early before your meetings. Also, before your meetings, be sure to review the materials. You're provided with one-pagers about all of our asks this year. Utilize those. Take some time to understand them. You're also very fortunate that because you're on the phone this year, you could have that in front of you while you're talking on the phone. So if you forget any details or you forget the bill number, you can have that right there in front of you. Also, as we mentioned, please designate a call leader or facilitator, if you will. They will help guide the call and will help keep everyone from talking all at once. Also, please choose which participant will present which issue. You have 2 asks this year, so I recommend choosing 2 participants, 1 for each ask. Note who's an actual constituent. My personal preference is if you have the constituent that is willing to be the leader or facilitator, that's probably the easiest route to take. That also provides a very clear, easy opener of, my name is Jamie Sexton. I'm a constituent. I live in Baltimore, Maryland. And they can give a very clear opener and they can explain, why they're there today and then introduce everyone on the call. Also, consider everyone's personal experience related to the policy issues when you're choosing who will present which issues. If you have someone who happens to be on the IVIG demo, of course, they're who you would want to present that particular issue. Identify the name of the staff or member of Congress that you're going to be meeting with. In the mobile tool that you're utilizing for the day, you should very clearly see who you're going to be meeting with. Make sure you glance at that before you hop on the call so you know who you're asking for when they answer. So you've called in 5 to 10 minutes early. You've designated a leader. You've chosen which participant will present which issues. It's now time to conduct the meeting. At the beginning of the meeting, be sure to clearly introduce participants on the phone and explain the mission of IDF. This is where that leader or facilitator is going to come into play. You're also going to be sure to have the individual or individuals that you're meeting with clearly introduce themselves as well. You're going to want to refer to them by name on the phone to encourage engagement during the conversation. So be sure that you have them introduce themselves, not only for that reason, but also so that you know exactly who all you're speaking with. It could be just the one person noted in the online portal, or it could be multiple members of the staff. You're also going to allow the designated leader to guide the call, introducing participants when it's their turn to present an issue or tell their story. As I've mentioned previously, this will help ensure that not everyone is speaking at the same time. It'll also help make sure that there is no dead time on the phone and no awkward silences while people are trying to decide if it's their turn to speak or not. Having the leader introduce whomever participant is presenting which issue before it's their turn will alleviate all of those issues. So conducting the meeting, and obviously meeting is there in air quotes because this is a very non-traditional meeting, but we think can be just as effective as if you were in person. As I mentioned, introductions are very important. You're also going to want to succinctly describe the issues. You're going to hear from Fakery Drinker a little bit later about the 3 C's of this meeting, but one of the most important ones is clarity. You're going to want to make sure that you're describing things as succinctly and clearly as possible. These meetings are scheduled just like in-person meetings. They're scheduled for 15 minutes. As with in-person meetings, they may end a little early, they may go a little long, but they're scheduled as if they're an in-person meeting, so you only have 15 minutes. And to be frank, it's a lot easier for a staff person to rush you off the phone when that 15 minutes hits, as it would be for them to rush you out of their office. So you're going to want to make sure you fit in everything you need to within those 15 minutes. You may have someone who has some extra time, they let you run long, but you never want to count on that. Again, share a concise, poignant personal story. Ask clearly what you want the legislator to do. You want to make sure that the person you're meeting with gets off the phone knowing exactly what two things you're wanting them to do. And again, Len went over those very clearly, so make sure you clearly ask them what you're wanting them to do. And of course, offer IDF as a resource. You'll have our contact information. It'll also be on the handouts that you're provided. If they have any further questions that you don't know how to answer, that is okay. Please offer us as a resource. That's what we're here for. And lastly, say thank you. This is a very crazy time, and they took time out of their day to talk with you for 15 minutes, and that's huge, and we greatly appreciate it, and make sure they know that we appreciate it. What to know about the meetings. So we know we have participants today from all over the country. However, all conference call meetings are scheduled in Eastern Standard Time. That's really important to remember. We understand that that means some people out in Washington State may be getting up a little early on the 23rd, and we really appreciate that. And we apologize. Unfortunately, DC is in Eastern Standard Time Zone, so that is the time that all meetings will be scheduled for. So please make sure you take that in mind when you are planning your day. As I mentioned before, conference calls are scheduled for 15 minutes. They may end early, they might go a little longer, but they're scheduled the same as an in-person meeting, so please don't count on having longer than 15 minutes. If that happens, great, but please make sure you're able to get both of those asks in within that 15 minutes. Some meeting pointers. These are all pretty common sense, but I always like to highlight them just to be sure. Always be polite, even if you don't agree with them. We have people coming from all walks of life to participate in Advocacy Day this year, all political beliefs. You're going to be meeting with elected representatives on both sides of the aisle today. Please be polite, even if they're the party you don't necessarily agree with, if you don't agree with how they've voted on things in the past, etc. Please be polite. They're taking time out of their day to meet with you and to hear your concerns. So please convey the appropriate amount of respect, regardless of where their views fall compared to yours. If asked questions, answer them honestly. And if you don't know, that's okay. You are there to be an expert in your story, not to be an expert in any particular piece of legislation. If you can convey the high points of a bill and they have some detailed questions, just point them in our direction. We'll get back to them. You have your online portal that you'll be leaving meeting notes in. Please note in that online portal if an office had a question that you didn't know how to answer, and we can get back to them. That allows you to tell us that without even having to communicate to us directly. You don't have to shoot us an email. You don't have to give us a call to ask us to follow up with an office. We'll be able to see those meeting notes after the event, and we'll know who we need to reach out to. So please be sure you're leaving detailed notes in that portal for us to see afterward. Again, don't expect a member or a staff person to commit on the spot. Provide IDF contact information for follow-up. If they seem like they're wavering, if they seem like they need a little more information to push them over the edge, please reach out to us and let us know that, and provide them with our contact information as well if they'd like to reach out directly. And again, a thank you goes a long way. This is a very hectic time on the Hill, and they're taking some time out of their day, so please show appreciation for that. Making your pitch in these offices. Please use your own authentic voice. If you are a mother of a child with PI, please be sure you're talking about how that impacts you. Don't feel the need to just paraphrase your child's story. Talk about how it impacts you and your fears for them. Use your own authentic voice. Of course, your child will likely be on the line, or if they're not, you can of course speak for them a bit, but make sure you're emphasizing how you're impacted by this PI as being a caretaker, and how these particular pieces of legislation impact you and your family. Share clean, logical arguments. It's very easy to get sidetracked, especially when you're speaking with elected representatives. Sometimes, you want to talk about other things that aren't necessarily our two asks for the day. I do want to emphasize that, you have 15 minutes, so you really want to share your clean, logical arguments about these particular asks. If, the staff person begins to get sidetracked, try to get them back on track to those two asks. Make a solid, persuasive case. Tell a true story and use personal examples. You're the expert in your story. You can put a face with these issues. You put a face with PI. Make sure you're making this personal. Ask for the outcome you want. Again, you want to clearly ask for what our two asks are for this year. Make sure you really emphasize those and really drive those home, and make sure you end on those points. And then, of course, I sound like a broken record. Please thank the listener. Follow up the thank you note. So you will have access to the contact information of the staff and the elected representatives you're going to be meeting with in the online portal, even after Advocacy Day wraps up. So you will still be able to access that contact information. Please use it. We will provide you with a sample thank you note for you to modify and send to the person or people that you met with. Please be sure to send that. We'll make it as easy as possible. And it also provides you and IDF a way to present those asks one final time. So please make a note to be sure to do that either at the end of the day on Advocacy Day or the next day, just to make sure that they know we appreciated their time. Also, please utilize IDF social media. Share that you're participating in Advocacy Day. Share the link and encourage others to participate. Since we've gone virtual this year, this event is open to our entire community. Please encourage all community members to take part in it. We highly encourage as much participation as possible. As I mentioned, there are various ways you can participate this year, and regardless of the way people choose to engage, we just hope that they do. Lastly, sign up for IDF Action Alerts. I think I plug this in any event any of you have ever seen me speak at. Our Action Alert system is our most basic way to let you know when there's an issue that we need you to take action on. Please go to this link, sign up. It's very simple, and it'll allow us to alert you when there's an issue either in your state or at the federal level that we need you to make your voice heard on. Thank you so much for the time. We really appreciate you taking part in Advocacy Day 2020. We know this virtual platform is a brand new thing, and we appreciate you testing it out with us.
Greetings, IDF advocates, and welcome to this part of our virtual advocacy training. Nick Minetto here with Faegre Drinker Consulting, and pleased to be with all of you virtually for our annual advocacy event. For brief introduction for those whom I have not met in the past, I'm a principal of Faegre Drinker Consulting. We used to be called Faegre Baker Daniels, and we merged at the end of earlier this year, and hence our new name of Faegre Drinker. And we have been fortunate to be working with IDF for about 4 years now. So this is our 4th advocacy conference, and like many of you, presuming this is one of your first virtual advocacy conferences. I'm going to also introduce my colleague now, Megan Herber, and then we're going to go through some practical tips that'll be useful, hopefully useful for you as you embark on this advocacy adventure.
Hi there, I'm Megan Herber. I'm also on the Faegre Drinker Consulting team with Nick. I'm a director here on the team. We're very happy to work with the IDF on all things government affairs and policy, including this Advocacy Day. Looking forward to it.
Thank you, Megan. So thinking about a visual image here, I think it's safe to say that the world has been turned upside down, and certainly Washington and Congress has been turned upside down by the recent events. So I've been working at the firm now for 16 years, and this is my very first virtual advocacy conference. So this is an item that an action that I thought, a few months ago, if you had asked would we ever be doing virtual fly-ins like this, I would have thought most unlikely, but it's a great example of how IDF and others have pivoted given the events of this day that you're all navigating. At the end of the day, the virtual advocacy day is very similar to what we would be doing if we were sitting in a hotel ballroom talking to you live and in person in terms of the ultimate goals and outcomes. This is a chance for you as advocates, as people impacted by PI, to be on Capitol Hill, meeting with your legislators, meeting with their staffers to make sure your voice is heard so they know what our priorities are, just like we would be doing under ordinary circumstances. However, obviously we're not in ordinary time. Everyone is remotely working, including Capitol Hill. And this is a great example of how we have had to pivot to make the best of the circumstances that we're in, and navigating these waters together. I think about the world over the past month or 6 weeks or so, kind of like BC and AC, before COVID and after COVID. If we were preparing for this in early February, we would probably be talking about a legislative climate that was increasingly focused on the national elections that are coming up, both the presidential elections and the congressional elections in November. At the time, the Democratic primary was taking a lot of time and energy. The big question was, who would the nominee be? How long would that race play out? And Capitol Hill was generally an afterthought for most of this year. There was generally the presumption was you were going to have a very limited legislative agenda, as most energy was going to be focused on the election and then what comes after, whether that be a lame duck session of Congress, which is the time if Congress reconvenes after an election and before the new Congress is sworn in, which would be basically November and December of this year, and much of the focus being on what comes next, whether that be a new administration or a second Trump term. But what we have seen, of course, over the past month has been a incredibly active period of legislating, with most of that activity, almost all of that activity, focused on the response to the coronavirus. It's kind of unfathomable for me to believe, again, that in the month of March, in a 3-week span, we had Congress enact 3 pieces of response legislation. One that started in the first week of March that was $8 billion, which was seen as a very significant figure at that time. But then 3 weeks later, by the last Friday in March, we had enacted into law a $2 trillion relief package. And even right now, there is continued discussion about a phase 4 and potentially additional legislative responses to the COVID-19 situation, depending on how things play out. So you're talking about a significant, just again, unseen before type of pivot from where we were at this time in late February, just 5 or 6 weeks ago, and where we are right now, which again is exemplifying the severity of this crisis. So just putting that all out there as a level set, given how much activity we have seen related to the response and how much activity we will likely be seeing over the days and weeks to come, particularly with you now being here on a virtual advocacy day, as Congress is likely reconvening after some time away following enactment of the most recent package in late March. So thinking about this, like I said in my introductory comments earlier, at the end of the day, this is an advocacy opportunity, whether you're on a phone, whether you're on a video conference, whether you're in person. The ultimate goals and objectives remain the same. It's our opportunity, it's your opportunity to engage with your lawmakers, with your staffers, with their staff, to make sure they know what your priorities are to drive progress for people impacted by PI. We have some challenges right now, driven by the COVID-19 pandemic. And the 2 big ones I think that are most relevant are engaging on items outside of the core coronavirus bucket right now, given the preoccupation with COVID-19. And then also the more on the logistical side is engaging with congressional offices, with staff and possibly members on a video conference. So we're going to focus a lot of our comments on how you can best prepare yourself for the reality of a virtual advocacy day. You've already been prepped on the ask in detail, and I think you know what IDF is prioritizing, but we really want to think about, in this situation right now, how to make the most of this opportunity, given the challenges that you have when you're doing this via phone. If we were again in the hotel ballroom right now, you'd probably be splitting up into your groups and having a chance to talk live, to coordinate your rhythm and your flow for your meetings. Now we're in the situation where you may be with people whom you never met before. You're not going to be able to do the eye contact to make changes on the fly. So there is going to be an important need to be more prepared. But at the same time, all these offices, this is all new to the Hill. They're going to be very flexible here. They're not going to expect perfection. They're doing these meetings for the first time ever. Staff have never done or in the way they've been doing these right now. This is a new pivot for Congress and for Capitol Hill. So I don't want anyone to be more worried or more concerned than you need to be, but certainly want to focus on at least 3 core categories that we think are important in terms of helping you be as prepared and as focused as possible. We call them the 3 C's. One is the need for coordination, given the virtual advocacy day, the need to be more concise in our remarks, given the challenge of being engaged on the phone, and the need to be very clear in our remarks. So with that, we'll go to the next slide, and I'll take a couple of these topics, and then I'm going to segue over to Megan. So coordination is always important. Again, all of you who have done this before know the need to coordinate with your larger group to make sure there's some clarity going into each meeting, particularly having a lead and knowing going into a meeting who is going to be responsible for what component of the meeting. A little later on, Megan is going to share with you a template agenda to help you guys organize your thoughts going into these meetings. But a few tips here in terms of the coordination that I think is even more important in a virtual world. One is to have a very clear leader or facilitator who is going to be essentially the moderator or the host, opening and closing the call and facilitating our speakers. This is someone who will thank the staff member for their time, particularly recognizing the challenges they're navigating right now with the pandemic playing out. And again, serve as a moderator. You introduce yourself, and then segue over to other members of the advocacy team, framing the agenda and being responsible to keep things moving as smoothly as possible in a virtual setting. That's especially important when you're transitioning to speakers. I think it's very fair and appropriate in a virtual setting to introduce and then reintroduce the people who are speaking, just so the staffer knows who is on the line. There may be some instances where our experienced advocates have existing strong relationships with the member or the staff, but for many of these meetings, we should presume that staff are not going to easily detect who is on the call. So being able to have a leader who is responsible for facilitating and moderating the discussion is very important. We also want to focus on, avoiding our jargon. We'll talk more about when it comes to being concise and being clear. Really try and boil this down to a very base level because of the challenges with being virtual, and that includes speaking for shorter periods of time, trying to be more direct with shorter sentences. Like I noted earlier, avoiding jargon, avoiding anything that may be too complex, and pausing for opportunities to ask, do you have any questions about that point? Or, how can we be helpful to clarify further? Would you like us to speak in greater detail? Rather than assuming that we would go long initially and potentially losing the attention of that staffer. So all of those are just some basic tips when it comes to the coordination of the meeting. So I threw in a little image here. What we want to avoid is a situation where the staffer on the call is zoning out. We all have been on conference calls before. We all know how tempting it is to multi or triple task when you're on a call, and the risk of being on a phone, in particular not a video, is that the person on the other line could be doing 4 things. That's, they may be checking their personal email, they may be getting a note from the boss, they may be working on another document that has to go out that's time sensitive. So to help address some of those concerns and try and make for a more engaging call with more interaction, we want to think about varying voices so that no single person is speaking for a lengthy period of time. We don't want to have a lot of monologues here. This isn't the type of session we want to have, one person going through 25 slides that are very dense with text, because we know there's really a risk there. The more time that goes on without variation, the more time that goes on without multiple voices and discussion, you could have folks who are maybe multitasking or zoning out. Again, try and keep our comments on the briefer side, a little bit briefer than you would do ordinarily if you're in person, and considering the role of using questions to help engage the staff or prompt the staff. Questions like, are you familiar with primary immunodeficiencies or immunoglobulin therapy? What questions can we answer for you? How can we be helpful? Just to try and check in at regular points of the discussion, at transition points and otherwise, so that the staff are engaging, so you're touching base with them, so it's not going to be a monologue and then you get to a point where they say, well, thanks very much, been great to be here, thanks, we'll see you next year, hopefully in person. We don't want that to be the outcome without some level of dialogue and discussion. So with that, so you don't have to hear me go on for any much longer period of time, I'm going to segue over to Megan, who's going to offer some additional guidance and tips.
Thanks, Nick. Yes, we're modeling our recommendation here, varying our voices. So in terms of our 3 Cs, I think these are all important for any type of Hill meeting that you're doing, but especially important as Nick described when we're doing it virtually. So far we've talked about we're going to be coordinated, we're going to be concise, and then I'm going to talk about the 3rd C, which is clarity. So we're going to be clear. So this is very similar to what Nick was describing, but be very basic in terms of describing and introducing primary immunodeficiency. Some offices may know you and may know PI really well, while many others will have new staffers. As you know, there's a lot of turnaround and turnover on the Hill, and maybe they've never heard of PI or experienced someone who's had it. So be very basic so that they can kind of understand what you're talking about. So think about how you would describe it to somebody who's just never even heard of PI before. And that can be tough when we're in a community of other people who know exactly what we're talking about. And sometimes we get into the medical and scientific background of things, but just take a step back and realize, okay, the staffer may not have ever even heard of this. How would I describe it to somebody like that? But then also being open in case there are staffers who have had more experience and you can kind of dive into more detail or answer questions as they come up. So we're going to do this very similar to the way that we would do in person. And so that means you want to be very clear with who you are and what we're talking about, and then also always very clear with the ask, right? So Lynn went over the asks earlier in this training. We want to make sure we hit those 2 points pretty strongly and make sure they understand. You know, a lot of times Hill staffers, they want all the background and they want to learn about you, but at the end of the day, their first question might be, okay, what do you want me to do about it? So make sure that they know that at the outset. So these are just a couple of examples of very simple explanations of PI and what immunoglobulin is. So I won't read the whole thing, but you can kind of read it for yourself. And these are just a way that you could potentially describe your condition, and then what that means in terms of the larger population of people with PI, and how that means that you are, you have some sort of immune system issue. And then also a simple way to describe immunoglobulin or IG. A lot of times, you know, we're guilty of this as well, but we'll start using the acronyms and say IVIG and SCIG, but staffers may not know what that means. And even if you say the words intravenous immunoglobulin, they still may not know what that means. So it's helpful to explain IVIG. That just means the type of administration of the drug is intravenous, so a needle in your arm, versus subcutaneous. So here we have a template call agenda. So this is to help you organize and coordinate. So feel free to get together with your groups who you're going to be on calls with and assign the roles, and then have the leader or the facilitator really follow a set agenda. And I think that will really help everybody. So again, the leader or the facilitator will be able to moderate and make sure that everything is staying on track, and that you're hitting your key points, and that everyone's being clear and concise, and that the staffer has a chance to ask questions and engage as well. So here's a sample of what you might do in terms of an agenda. Of course, you do introductions, and you ask the staffer or the member of Congress to introduce themselves, and always thank them for their time, especially during this busy time when they're all dealing with the coronavirus pandemic. And you can always ask them, you know, hey, are you familiar with PI? And that will help you gauge how much detail to go into in terms of what PI is. So you'll have your leader facilitator, and that person can share a story, but you may also want to have a different person designated as the story sharer. And you might have I'd say 1 to 3 people sharing their stories, 1 or 2 probably being ideal. But if you have multiple constituents of the member, make sure that your constituents get a chance to share their stories. And especially if you have a couple of people on the call with different stories, that will help highlight differences of experiences of people with PI. And then the leader would go through the policy agenda and the policy asks and think about potential questions to engage the staffer, and kind of moderate that question and answer with the staffer. And you can maybe talk about with your groups ahead of time, you know, who will answer what questions, or will the leader just answer all questions and then kick it over to other people they know in the group might have expertise on a specific topic. But a piece of advice that we had is only really answer questions that you know the answer to. If they ask you something out of left field, or it's not something within your experience and you're not sure, feel free to say that, you know, say, we'll get that information and get back to you. And you can always reach back out to us or to Lynn or to Jamie and let them know, you know, this office had a question about the number of people with PI in our state. I don't know that number. Can we provide that to them over email later? So we can always do that. And then just make sure that the leader closes the meeting and again, thanks the member and the staffer for the time, and make sure that you've made the ask very clear. And it's always a nice idea to ask if you can follow up over the coming weeks as well, because then you can send all the information over email, and then it makes it much easier for them to make that ask, especially if you're talking to staff and they have to then write a memo to their boss to ask them if they want to sign on to a bill or a letter. Now, if they have that all in writing over email, that really helps them. So Lynn already went over the 2 asks this year. But just to reiterate, so they're extending the Medicare in-home IVIG demo project and moving towards making that a permanent benefit. So as you all know, the Medicare IVIG demo expires at the end of this year. We'd love at some point to make this a permanent benefit in the Medicare program. And until that happens, we'd love to keep extending the demonstration project so that people still have access to IVIG in the home. So we know that Congressman Brady and Congresswoman Matsui have been working on this ever since they initially created the demonstration project in 2012, and they're working on legislation to potentially extend or make it permanent. So there's not existing legislation at this point for you to ask the members to sign on to, but you can ask them for their support when that time comes. The second ask is for an existing piece of legislation. In the Senate side, it's S3457. On the House side, it's HR 6218. It's the Preserving Patient Access to Home Infusions Act. So this will make sure that people continue to have access to subcutaneous IG or SCIG. So lastly, we just wanted to touch on PI and the coronavirus. Our asks this year are more long-term asks that we've been fighting for and advocating for a while and want to continue to see into the future. But it's very important, as coronavirus is on everyone's minds, including ours, including staff and members of Congress, that we really make that connection between the experience that you're having with having PI during this coronavirus pandemic and how that relates to the community's needs. So you can note that there are particular challenges for the PI community, since people with PI have impaired immune systems. And you can tell your story of, you know, you're used to washing your hands and following all the public health measures that now the general public is becoming more familiar with. But those are things that have been part of your day-to-day lives for your whole life. And I think that will really paint a picture for staffers who may not have understood that in the past. Now they're experiencing these precautions themselves, and they'll really stop and think, you know, this is how some people live their lives all the time. And then also how you're affected during this crisis specifically as well. You know, you're more susceptible to any infection, and sometimes that can also be more life-threatening, right? So not only do you normally take precautions, but you have to take extra precautions during this time to protect yourself from COVID-19 specifically. So it's important to let the members of Congress and the staff know how this affects you and why it's so important for our asks that patients still have access to the treatments that they need in their homes, right, during this crisis and going forward. So that's the last bullet point there. The pandemic kind of underscores the importance of the access to IV therapies in the home setting. And so you can kind of tie it all together, and it's important now during coronavirus, but the coronavirus pandemic situation really illustrates the need for this going forward. So with that, I think we will conclude, and I'll kick it over to Nick to give some concluding remarks.
Thank you, Megan. So just a couple other points I'll make here, and Megan, feel free to jump in too if there's anything else you'd like to add. I just say, usually we talk a little bit about the housekeeping for meetings. All those same points apply here. Certainly be kind, be considerate to the staff, thank them for their time. If a meeting is shorter, if a meeting ends up going a little bumpier, don't get frustrated. This is all, again, very new to the Hill staff who are not used to doing calls like this. So be patient, be thankful for their time, and then we can obviously help with follow-up and the follow-on engagements that come from all these activities. And I would just add, again, this is really uncharted water for a lot of us. So don't be nervous going in. If everything doesn't segue exactly as you would hope, don't be discouraged. As you do more of these meetings, you'll probably likely find a rhythm just like you would do if you were on Capitol Hill. But really, it's awesome that you are all here participating. It's always great that you come in and participate in advocacy days in person, but even transitioning to this virtual advocacy day, making sure that your voice is heard despite everything else that is playing out is even more critical because of the amount of noise. The volume has just been turned up exponentially given the magnitude of the pandemic. It would have been very easy for IDF to have said, we're just going to bag it this year and we're not going to worry about coming in or doing any advocacy touches like this, but that would fill a void. That would make it more difficult to remain visible and to remain active and to make sure our items are on the agenda. So doing this, being present, being engaged like you are through this virtual advocacy day is just so important. And I thank you all for participating and wish you the best in all of your meetings, virtual meetings.
Yes, thank you and good luck.
If you have any questions, please feel free to email us at the email address provided below. Thank you.